In the previous section, I introduced the general topic of diabetes and spoke especially about type 1. Now, I am going to talk about type 2 and give more general advice about diet for both types. In type 2 diabetes, non-insulin dependent diabetes, the pancreas continues to manufacture insulin, sometimes even at higher than normal levels, but the body develops resistance to its effects, resulting in a in a relative insulin deficiency. It may occur in children and adolescents, but usually begins after the age of 30 or with pregnancy or later in life. It tends to run in families. Some common causes are pregnancy itself or abnormally high levels of corticosteroids or certain medications which may have a toxic effect in the body, which interferes with the production or effects of insulin in the body, or with its effects resulting in higher sugar levels. When blood sugar passes above 160 to 180 milligram per deciliter, glucose passes into the urine. A person with diabetes passes large volumes of urine frequently, polyuria we call it, and therefore feels more thirsty and drinks more water. Sometimes the person loses weight, that is also another way of showing it, through the excess calories being passed in urine. He or she feels excessively hungry and experiences drowsiness, blurred vision, and some infections sometimes. Type 2 diabetics should avoid fried food and have more proteins with less fat in them, such as fish and chicken with their skin off, and beef with olive oil. They should take less lamb or no lamb is better. They may have low fat cheese or yogurt, but these have little sugar and should be consumed in moderation. They should avoid shellfish as they put pressure on the liver and pancreas and can produce stomach acidity and other health issues. It is best to have fresh vegetables, either steamed or boiled, but not fried. Carbohydrates should be taken in moderation. For example, one piece of toast, it is better to have semi-brown bread. Ciabatta is soft if you prefer soft bread. They are fine. Sourdough is also fine, but it's a bit harder. Now, rye bread does not increase sugar as much as other types of bread. So maybe some people would like to have rye bread, but it could be a little bit cool on the stomach and sensitive for the people with the stomach problems. One can make rye and oats and buckwheat bread to balance the sugar, because buckwheat also lowers the sugar level, but not for glycemics, because glycemics, their sugar level comes down anyway. They have low sugar levels or a tendency to reduce sugar levels rapidly. They have boiled or scrambled eggs, but not fried. I keep saying fried food is not very good, so you have to remember that. Vary your suitable diet and have a different um, variety of food for breakfast from protein, carbohydrates, and vegetables. As a snacks, try mulberries, ideally fresh or pure in a dried form. Avoid those mixed and flavored ones to create snacking foods. Sometimes they add other ingredients to mulberry to flavor them. Avoid those. Pure mulberries actually reduce sugar in blood. Instead of crisps and unhealthy snacks, make um, thin slices of aubergines. Take the toxins out by spreading them on a tray and sprinkling salt on them. Leave them for 10 to 15 minutes, then wash away those toxins. You can see the yellow toxins coming out. Wash them away. Dry them and put them on foil with some olive oil and put them under the grill. They are fabulously tasty and replace ordinary crisps. Much better for your health. They actually lower cholesterol too. For lunch and dinner, use your imagination to take more protein, more vegetables. For dessert, try mulberries, seeds like sunflower seeds, and a few almonds and walnuts. Now, take out the toxins from walnuts. Like aubergines, walnuts have these toxins. So, by soaking them, because they're dry, you can't sprinkle salt on them. You have to soak them in salt water overnight. Wash and dry them with a cloth, and then add them to other nuts and seeds. Put them in a blender and crush them with mulberries. Squeeze one lime, not lemon, and add a little stevia or honey. Honey is better because it would give it a better mixture. For sweetener, if you wish, turn the mixture into any shape you like, as it might be a bar of chocolate, and keep it in a refrigerator for dessert, and you can have it sometimes. The type of carbohydrates they eat is especially important. The diabetics they eat is especially very important. Sugary foods such as cakes and biscuits will raise blood sugars more rapidly and to higher levels, so that they require more medication or injections. Moreover, moreover sugary carbohydrates often do not last long in the body, so that blood sugar may drop before diabetics take their next meal, and they feel a little bit, glycemic. Slow acting carbohydrates, such as cereals and bread, do not raise blood sugars so rapidly, or so highly after eating. They last longer and therefore tend to give more even blood glucose levels to you. Therefore, they would be beneficial for both type 1 and type 2 diabetics. It's good. It is important for both types of diabetics to eat sufficient carbohydrates before, during, and after exercise to avoid hypoglycemia. Eat slow-acting carbohydrates such as bread and cereal before exercise. Eat fast-acting carbohydrates after exercise. For example, a piece of fruit or biscuit, or take fruit juice. These are fast-acting carbohydrates. Vitamins and supplements are very important to harmonize the body's organs with diabetics medication, and in some cases reducing the medication required for type 2 diabetes. Before breakfast, have flaxseed oil for men or evening primrose oil 500 milligram. Make sure it's 500 milligram and not 1000 for women. Alternatively, if you are not on blood pressure medication or blood thinner, take omega 3, 6, 9 twice a week with a glass of water. After breakfast, have vitamin C, 1000 milligram, slow release if you prefer, vitamin B complex, 50 milligram capsule by Solgar, and that's a very good one, a very good pure brand, and 1000 milligram tablet of L-lysine each day. After lunch, take half a multivitamin with a higher level of chromium, such as diabeton by Vitabiotics. But you have to test that. If you feel sweating, that means it's too much chromium, and go back to a gentler, smaller chromium amount of a multivitamin. If you are pre-diabetic, take the other half of this multivitamin, diabeton, or a different multivitamin after your evening meal. If you are type 2 diabetic and taking doctor's medication for it, such as metformin or any other medication, you do not need to take the other half of the multivitamin at all. Just take your doctor's medication, metformin. The best exercise for diabetics or for people actually is walking or gentle dancing or table tennis. Nothing strenuous that is making you more glycemic. Drink 2 liters of water each day. Drink raspberry leaf tea and nettle tea made in a pot with fresh mint and fresh fenugreek or powdered fenugreek. It's a herb actually. It's very good for diabetics. So you can drink this. Get herbs to help your liver and pancreas. That's very important. The best is milk thistle complex by Dr. Vogel, made from 4 herbs, so it's quite good for the liver. Put 20 drops in the tea that I mentioned before, I have just mentioned, or in a little bit of water. Also add 15 drops of Dr. Vogel's Passiflora because it relaxes the liver, digestive system, pancreas, and the anxiety that the diabetics they feel, either to the tea or with a little bit of water. If you are accompanying, I would like to mention this, or caring for a diabetic of either type 1 or type 2 of any type, and you see him or her experiencing signs of glycemia, that is, the sugar has come down too much, especially dizziness or faintness or blurred vision, and especially during strenuous movements, the best immediate response is to give them a biscuit which combines sugar and complex carbohydrate. So it's much better than just, sugar or chocolate. A few biscuits are always better for diabetics, like I mentioned before, and their companions to have with them, better than chocolate, and lumps of sugar. Thank you very much. I will be in touch again regarding diabetes, further information to you. Thank you. Bye.